He may even identify himself with it and believe that he is what he appears to be.
Welcome to the NCE Study Guide. I created this study guide using ChatGPT and Notebook LM. So think of these modules as AI-powered audio flashcards. Each one of these 20 modules contains 10 mock questions representing the kind of questions that you might encounter on the National Counseling Exam. I created this primarily for myself, and I decided to make these available to anyone else who might benefit from this kind of study aid. But please note, while I have done my best to ensure that these modules align with NCE content, I encourage you to cross-reference them with trusted study guides and resources for the most accurate preparation. These modules are not affiliated with or endorsed by the NBCC or any official licensing board. And today I'm introducing a new case study module. Now, as you may already know, I took the NCE and I passed it a few weeks ago, but I learned so much from putting these modules together, and I enjoy seeing the downloads increase and hearing from listeners who reach out. So I've decided to take this case study approach to kind of bridge that gap between prepping for the NCE and really getting started as a mental health care professional in the field, really understanding the ethics and the different modalities and the interventions and how would I do a diagnosis for certain situations. So that's what you're going to be hearing in these case study modules. And I also want to remind you that I'm putting together a grassroots study group for anyone who is looking for some real life person interaction as you prep for the NCE, not just these AI puppet shows. So if you're interested, email me at ncestudyguide@gmail.com. So, with no further ado, here are your AI study buddies from Notebook LM. Enjoy.
Nice to be in orbit.
Welcome to this deep dive. Today we're looking at case study module 7 of 10.
That's right.
If you're listening, you're probably prepping for the NCE, and that's exactly what we're here to help with.
Yeah, the goal is to get you that crucial knowledge, quickly, thoroughly.
And hopefully spark some aha moments without making you feel overwhelmed. This deep dive is tailored for that.
Exactly. And today we're diving into a really valuable resource, the NCE Study Guide.
Okay, so let's unpack that. What is the NCE Study Guide?
It's a series of study modules. They were created by Glenn Ostlund, who successfully passed the NCE himself.
Oh, great. Someone who's been through it.
Right. And his background is pretty interesting. He has master's degrees in folklore and clinical mental health counseling.
Folklore? That's different.
Yeah. And he's been podcasting since 2010, so he understands communication and learning alongside the counseling field itself.
Okay, so these modules, they weren't just thrown together.
Not at all. And this is the really interesting part. Glenn developed these research-backed modules as part of his own NCE prep.
Ah, so he built the tool he needed himself. That makes sense.
Precisely. And how he did it is fascinating, too. He actually uses ChatGPT to help write and refine the case studies.
Okay.
Really digging into theory, research, ethics, all that core stuff.
Mm-hmm.
Then that content goes into a Google Doc and then into Notebook LM.
Notebook LM, what's that?
It's an AI tool. It synthesizes the material, looks at it from different angles.
So it helps create a richer learning experience.
Exactly. The result is this dialogue-rich experience, kind of mirroring the critical thinking you need for the NCE.
Wow.
Glenn actually calls this whole process an AI puppet show.
An AI puppet show. I like that. It captures the collaborative, creative feel.
It really does.
Now, if folks listening find this useful and want to connect with others, I understand Glenn runs a study group.
Yes, a weekly study group just for listeners. If you want to learn more or join in, just email ncestudyguide@gmail.com.
Great resource, NCE-studyguide@gmail.com.
And, it's not just about receiving info. Glenn also wants to hear from listeners.
Oh, yeah.
Yeah, if you have suggestions for future case study topics or specific counseling issues you'd like us to cover,
Send them in.
Yep, same email, ncestudyguide@gmail.com. Your ideas make these deep dives even better.
Perfect. So today we're focusing specifically on case study 007, Devon, the college student in crisis.
Right.
And our mission here is to really get a handle on the key ethical stuff, the assessment angles, relevant theories, and interventions in this case.
And we'll wrap up by reviewing some NCE-style questions related to Devon's situation.
Okay, let's jump into the case itself. Devon.
Okay, so Devon is 19, a college sophomore, identifies as non-binary, uses they/them pronouns.
Mm-hmm.
They were referred to counseling for depression, isolation, and pretty significant academic burnout.
Right, and the details. They report low motivation, sleep problems, crying frequently.
Yeah, and a lot of anxiety around their identity, gender, and sexual orientation.
Plus, there's conflict with parents. They're supportive financially, but don't really understand Devon's identity.
That's a big stressor. Add to that uncertainty about a recent major change.
And this feeling of being a letdown, struggling to keep going, it sounds like a lot.
It really is. Looking at their history, Devon's a first-generation college student,
Okay.
identifies as non-binary and queer. No history of psychiatric hospitalizations, no reported substance use beyond some social drinking.
What about social support?
They have one close friend, but apparently that friend's been a bit withdrawn lately.
Adding to the isolation, maybe?
Could be. And importantly, Devon mentioned passive thoughts, like not wanting to wake up.
Okay, that's serious.
Yes, but they deny specific suicidal intent or a plan. That's a key distinction we need to track.
Absolutely. And any medical issues?
No reported medical concerns. So that's the snapshot of Devon's situation.
Okay, a really complex picture. Let's move into the first big area for NCE prep. Ethical considerations. This falls under ethics, social, and cultural foundations.
Right. And number one, especially in a college setting like Devon's, is confidentiality.
And its limits.
Exactly. The counselor must clearly communicate those limits right from the start. What stays private, what might need to be shared, and why.
Crucial for building trust.
Absolutely. And given the depressive symptoms and that passive ideation,
Suicide risk assessment.
constant monitoring and assessment, it's an ongoing ethical responsibility. You can't just ask once.
Definitely. What else ethically?
Multicultural competence. This is huge here.
For Devon's non-binary identity.
Yes. Providing affirmative, inclusive counseling. Respecting their identity.
Yeah.
Consistently using their pronouns.
Sounds basic, but it's fundamental.
It is. And avoiding any pathologizing of their identity exploration is key. It's not an illness to explore who you are.
Right, avoiding assumptions or judgment.
Then there's developmental sensitivity. We need to acknowledge that exploring identity, asking big questions, that's pretty normal for emerging adulthood. Devon's 19.
Right, in that stage.
Yeah. And we also need to consider systemic barriers. What challenges might Devon face as a queer student dealing with all these stressors? It's not just internal stuff.
Good point. The broader context matters.
And finally, competence and referral. The counselor needs to be trained in LGBTQIA plus issues.
And if they're not?
Then the ethical thing is to get supervision, get training, or make an appropriate referral to someone who is competent in that area. Client well-being comes first.
Knowing your limits. That's so important for the NCE in practice. Okay, let's shift to assessment and diagnosis. That's appraisal, diagnosis, human development on the NCE.
Right. So for assessment, the study guide suggests a few tools for Devon.
Like what?
Well, the PHQ-9 is a good start.
Yeah.
Patient Health Questionnaire 9, it screens for depressive symptoms, severity.
Standard tool.
Very standard, very useful. Then the GAD-7 for anxiety. Similar self-report format.
Okay, depression and anxiety covered. What about the identity piece?
Good question. The Identity Distress Survey, or IDS, could be helpful there. It specifically looks at developmental stressors around identity.
Ah, okay.
And, crucially, given the passive ideation, a suicide risk screen? The Columbia Suicide Severity Rating Scale, the CSSRS, is a good one.
The CSSRS. Got it. So, using these tools, what's the likely diagnosis picture?
Based on the symptoms, low motivation sleep issues, crying, the primary diagnosis seems likely to be major depressive disorder,
Right.
probably mild to moderate.
Okay. But are there other possibilities to consider? Rule-outs.
Definitely. You'd want to rule out adjustment disorder with mixed anxiety and depressed mood. The stressors are clear major change, family conflict,
Makes sense.
also generalized anxiety disorder, given the anxiety about identity.
Mm-hmm.
And then there's the identity-related distress itself. And this is critical,
Yes.
we don't pathologize identity exploration unless it's causing significant dysfunction or distress that meets clinical criteria.
Right. Exploration isn't inherently a disorder.
Exactly. So the formulation insight here is that Devon's depression seems really intensified by this mix of identity confusion, academic pressure, and family disconnection.
All common issues for this age group, but hitting Devon particularly hard.
Precisely.
Okay, that clarifies the diagnostic thinking. Now, theoretical approaches. What theories fit best here? This ties into counseling theories and multicultural competence for the NCE.
The study guide points to 3 that are particularly relevant for Devon. First, affirmative therapy.
Okay, tell me about that.
It's centered on supporting LGBTQIA+ clients, helping with identity development, building resilience against stigma, navigating systemic issues.
So really validating and empowering for Devon.
Absolutely essential in this case. Second, person-centered therapy.
Rogers. Unconditional positive regard.
Exactly. Providing that core of unconditional positive regard, empathy, genuineness, it creates emotional safety. That's vital when someone's facing rejection or confusion like Devon.
A safe harbor, essentially.
Yeah. And third, narrative therapy.
How does that apply here?
Narrative therapy helps clients externalize the problem story, see the depression or the identity struggle as separate from their core self. And then it helps them rewrite that story, reclaim authorship, focus on strengths, resilience, their preferred identity.
So shifting from feeling like a letdown to authoring a different narrative.
Precisely. It can be very empowering.
Great theoretical options. So linking theory to practice. Let's talk interventions. What would the counselor actually do? This hits the helping relationships and developmental focus domains.
Okay, early phase. Number one goal, build that trusting, non-judgmental relationship. That's the foundation.
Always key.
Then, provide some psychoeducation. Normalize identity exploration in emerging adulthood. Let Devon know they're not alone in questioning.
Reduce some of that pressure or shame.
Exactly. And maybe start some simple mood tracking, introduce some basic coping skills like journaling or mindfulness, something practical right away.
Okay, build rapport, educate, offer initial tools. What about the middle phase?
That's where you might really lean into those narrative interventions. Help Devon actively challenge the problem story, find exceptions, build that counter story focused on strength.
The reauthoring part.
Yeah. And continue to affirm and explore their gender identity and sexuality, always non-pathologically.
Keep validating.
Absolutely.
Yeah.
And for the academic stress, CBT tools can be great. Challenging perfectionism, that all-or-nothing thinking.
Practical cognitive skills for the burnout.
Right.
What other psychoeducation topics might be useful?
Well, beyond identity, talking about depression itself, what it is, the mind-body connection can be demystifying and empowering. And critically, connecting Devon with resources. Campus LGBTQIA+ center, academic support, maybe peer groups, even off-campus community support.
Building that support network.
Crucial for reducing isolation.
So how do we know if this is working? What are the signs of progress?
You'd look for improved mood, better sleep, maybe increased clarity and comfort around their gender identity, feeling more confident expressing it.
Okay.
Also a stronger sense of autonomy, more self-compassion, maybe getting back on track academically, less shame.
Yeah.
Those sorts of shifts.
Tangible changes in feeling and function. Got it. Okay, we've covered a lot. Ethics, assessment, theories, interventions. Let's synthesize. What are the key takeaways from Devon's case specifically for the NCE?
Well, first, it's a prime example of supporting identity development ethically and clinically in young adults. Big NCE topic.
Right.
It really underscores the importance of affirmative therapy for LGBTQIA+ clients. It shows that intersectionality, how depression connects with cultural, academic, developmental factors, you need a holistic view.
Can't look at things in isolation.
Nope. It also reinforces using assessment tools to differentiate diagnoses, like depression versus adjustment.
Using the data.
And overall, it just drives home the need for multicultural competence and inclusive practices. Vital for the exam, vital for practice.
Absolutely. A very rich case study. Okay, ready to test our knowledge with some NCE-style questions based on Devon.
Let's do it.
All right. Question 1. Devon's identity exploration and emotional struggles are developmentally consistent with which stage? A, middle adulthood. B, late adolescence merging adulthood. C, childhood. D, late adulthood.
Okay, Devon's 19. That puts them squarely in B.
Sure.
Late adolescence merging adulthood. That's the classic time for identity formation, role exploration, and emotional ups and downs.
Makes sense. Question 2. What ethical responsibility does the counselor have when working with a non-binary client like Devon? A, avoid using any gendered language. B, use the client's chosen pronouns and affirm their identity. C, ask the client to choose a binary label for insurance purposes. D, focus only on academic concerns to avoid discomfort.
The clear ethical answer is B, use the client's chosen pronouns and affirm their identity. Affirmative practice means respecting and validating their identity, using their language, avoiding microaggressions. Option C is unethical, D is avoidant, and A might be impossible or unhelpful.
Right. Affirmation is key. Question 3. Which theoretical approach is best suited for supporting Devon's exploration of identity and self-authorship? A, rational emotive behavior therapy. B, Adlerian therapy. C, narrative therapy. D, Gestalt therapy.
I'd go with C, narrative therapy. It's specifically designed to help clients reframe those identity narratives, resist dominant stories that cause distress, and really empower them to author their own preferred story. It fits perfectly with Devon's need to define themselves.
It's that externalizing and reauthoring piece. Okay, question 4. What assessment tool would be most useful to evaluate Devon's level of depression? A, MMPI-2, B, Strong Interest Inventory, C, PHQ-9, D, Rorschach.
For screening and tracking depression severity, the CPHQ-9 is the most direct and appropriate tool here. It's widely used, quick, and specific to depressive symptoms. MMPI is broader, Strong is career, Rorschach is projective.
Got it. PHQ-9 for depression. Question 5. A counselor who is not trained in LGBTQIA plus counseling should A, refer immediately without building rapport. B, educate themselves and seek consultation while supporting the client. C, avoid addressing gender or sexuality. D, treat all clients exactly the same.
The most ethical and responsible course is usually B. Educate themselves and seek consultation while supporting the client. Competence is crucial. If you lack it, you need to actively gain it through training and consultation. Avoiding the topic, C, is harmful. Immediate referral, A, can disrupt rapport unless absolutely necessary. And treating everyone the same, D, ignore specific needs.
Strive for competence while providing support. Okay. Question 6. Devon expresses thoughts like, I'm letting everyone down and I'll never succeed. What CBT concept does this reflect? A, positive reinforcement. B, automatic thoughts. C, classical conditioning. D, repression.
Those phrases are classic examples of B, automatic thoughts, specifically automatic negative thoughts. CBT focuses on identifying these thoughts that pop up and evaluating or challenging them.
Right, those immediate, often unhelpful cognitive responses. Question 7. A key benefit of affirmative therapy is A, avoiding difficult conversations. B, providing a non-judgmental space for LGBTQIA plus clients. C, focusing only on career planning. D, pushing the client to label their identity.
The core benefit is B, providing a non-judgmental space for LGBTQIA plus clients. It's about creating safety, validation, and support for their identity development and overall well-being, not avoiding issues or pushing labels.
Creating that safe space. Question 8. Which action by a counselor demonstrates cultural insensitivity? A, asking Devon what pronouns they use. B, assuming Devon's gender identity is a phase. C, encouraging Devon to explore campus LGBTQIA plus supports. D, validating the client's identity struggles.
The clear example of cultural insensitivity is B, assuming Devon's gender identity is a phase. That's dismissive, invalidating, and a common microaggression. Asking pronouns, A, is respectful, suggesting resources. C, can be supportive and validating struggles. D is therapeutic.
Dismissing their identity is the insensitive part. Got it. Question 9. What would be a key progress indicator in Devon's case? A, complete resolution of identity concerns. B, increased clarity and confidence in expressing identity. C, isolation from campus community. D, avoidance of academic responsibilities.
A key indicator of positive progress would be B, increased clarity and confidence in expressing identity. This shows growth in self-awareness and self-acceptance. Complete resolution, A, might not be realistic, or the goal. C and D are negative indicators.
Increased confidence and clarity. Makes sense. Last one, question 10. What suicide assessment tool is appropriate for a client like Devon with passive ideation? A, Myers-Briggs. B, KJADE. C, CSSRS. D, WAIS-4.
For assessing the nuances of suicide risk, even passive ideation, the CCSSRS, Columbia Suicide Severity Rating Scale, is the most appropriate choice here. It's specifically designed for this purpose. Myers-Briggs is personality, KJADE is substance use, WAIS is intelligence.
CSSRS for suicide risk assessment. Okay, we covered all 10. So wrapping up, this deep dive into case study 007 really shows how these NCE domains, ethics, assessment, theory, intervention, all weave together.
Absolutely. It's about seeing the connections and applying the knowledge practically, which is what the NCE tests. Understanding how these pieces fit for a client like Devon is crucial.
We really hope you'll consider the nuances here, how different approaches might shape the work with Devon.
Remember, Glenn Ostland's NCE Study Guide has more modules like this covering a range of NCE topics. A great resource.
And don't forget that weekly study group if you want more discussion and community support. Just email ncstudyguide@gmail.com for the details.
Same address if you have questions or ideas for future deep dives, ncstudyguide@gmail.com.
Okay, before we sign off, here's a final provocative thought to mull over as you continue studying. How might a counselor's own identity and experiences influence their work with a client like Devon?
Ooh, good one.
And what ethical considerations pop up at that intersection? Something to think about.
3. Nice to be in orbit.